Wolfram syndrome, a genetic neurodegenerative disease that leads to many different abnormalities including diabetes insipidus, inability to concentrate, the urine, diabetes mellitus, the usual type of diabetes, blindness due to optic atrophy, degeneration of the nerve to the eye, and deafness. Patients usually also suffer from severe abnormalities of the nervous system that can be accompanied by behavior problems, psychiatric hospitalizations, and, in about a quarter of cases, suicide attempts. Wolfram syndrome is sometimes referred to as DIDMOAD, diabetes insipidus, diabetes mellitus, optic atrophy, and deafness. Only the insulin-dependent diabetes mellitus and optic atrophy are necessary to make the diagnosis. The syndrome is inherited as an autosomal recessive trait, so that brothers and sisters of a child with the syndrome each have a 25% chance of receiving the gene from both parents and therefore having the syndrome. The syndrome is caused by a mutation in the gene responsible for the production of a protein called Wolframin, resulting in loss of function of this protein. The gene is in chromosome for p16.1. Wolfram syndrome is genetically heterogeneous mixed. There is, for example, the type of Wolfram syndrome with additional atypical features such as profound upper gastrointestinal ulceration and bleeding, as well as an absence of diabetes insipidus. The gene for this type of Wolfram syndrome is not in the region of chromosome for p16.1 but rather is in chromosome for q22.